analysis revealed an urban-rural imbalance. 70% of medical doctors were serving 12% of the population. Mothers in the underserved districts have had to, unfortunately, trust the rudimentary skills of the traditional birth attendants, or TBAs.
Traditional birth attendants are a big part of our culture here in Karamoja. They're a big part of other cultures, I believe, in Western Uganda, even in Central Uganda.
Many sadly losing their lives in the untrained hands of the traditional birth attendants.
We're not encouraging the population to go to them, but we know it is inevitable. If you looked at somebody who is 54, 45 years right now, they were most probably delivered by a TBA.
The health sector has to train, recruit, and retain midwives to save the mothers.
Every mother who dies, we as health workers get concerned, and so we establish what we call a maternal death audit for this particular mother. Yes? And who does it? You know, it's the midwives.
Staffing in the regional referral hospitals has fallen dramatically from 79% in 2014-2015 to 69% in 2015-2016. One main reason for the decline is massive retirement of health workers, not backed timely replacement recruitment. Regional referral hospitals with the most severe shortage are Moroto at 40%, Soroti at 56%, and Hoima at 59%. We drove to the underserved district of Moroto and Nakapiripirit and spoke to the district health officer, Dr. Abubakar, and asked about the midwife to patient ratio.
Generally, in the health sector, we had about 40% of our staffing level, or qualified positions filled.
You are the only midwife. You fear going out because you realize that if you have a mother comes and you are not there, the mother will have, and that was why there was a number of maternal and perinatal deaths.
It's against this background that UNFPA and Maristops Uganda, together with the Ministry of Health, are working to train and absorb midwives in these underserved districts.
By having these midwives there, really it improves the health service delivery, just by their presence in this health facility.
First of all, even us as midwife, we are happy because you go to the facility, you get all the equipment already. You can conduct a mother, you have all the delivery kits available. Your work is only to do the sterility of the procedure. Like this level, we have more than 20 to 30 deliveries per month, and yet you realize that previously, when we were having only one midwife, it was very difficult.
A total of 90 midwives have been recruited in health centers in Karamoja region, in Abim, Nakapiripirit, Napak, Amudat, Kabong, and Moroto. In the eastern region, Bujiri, Buyende, Kaliro, Kamuli, Luka, Mayuge, Namaengo, and Namutumba.
Right now as we talk, we want to recruit another 8. Yes? And the years that came previous to those, we are talking about 10, 9, in the ranges of 9 to 13 midwives trained, in each cycle. Every midwife that you'll find working for Moroto District Local Government, yes, about 90% of them, or even more, have an attachment to UNFPA.
By the way, we are even being trained on obstetrical emergencies, whereby if there is any complication that has occurred on the mother, because our facilities are far from referral hospital, so we are trained to manage these mothers when the mothers develop PPH, when the mothers develop APH, or when the mother is having any other complications. We can at least manage this mother before we refer. Not only that, UNFPA trained in the district here, they trained 2 senior midwives, where these midwives are moving around to do mentorship on how to manage baby, especially helping babies breathe, helping mothers survive. UNFPA also supplied some of the health facilities, like here. We have a motorcycle, whereby if a motorcycle is in good condition, we are able to pick the mother at the facility, at the villages, But also, they brought in innovations, whereby We have innovation through UNFPA, UNICEF, by other partners. We have here babies examination coaches, where these babies are being examined. If a baby is having difficulties in breathing, baby is having severe asphyxia, baby is having all those complications, we first do this resuscitate this baby and we give to the mother.
We have seen a trend of improved service delivery in terms of maternal survival, in terms of immunization coverage. You know, a midwife is not only trained in looking after pregnant mothers. No. A midwife can treat a sick child. And so all this service delivery has improved.
This is the way to go if healthcare is to be of value to Ugandans.